OAB. Okay. So I would like to just share first some views on OAB.
Hello, everyone. A very good afternoon to all of you. I'm Sayukta from Bladder Wellness team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when at public places. OAB, or an overactive bladder, is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. Let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of an overactive bladder, today we have with us renowned Dr. Krishna Karthik. Dr. Karthik is Senior Consultant Urologist from SV Urology and Andrology Hospital, Hyderabad. Dr. Karthik is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good afternoon to you, Dr. Krishna Karthik, and a very, very happy Doctor's Day, sir.
Thank you, ma'am. So nice of you. Kind of you.
Dr. Karthik, as today we are going to talk about overactive bladder. First of all, we'd like to have some clarity what an overactive bladder is.
Yeah, well, I'll let you know first what is the basic physiology and basic things of it. Normally, for a 24-hour period, usually human being void somewhere around 8 times to 10 times. For example, if we take it 8 times a day or night total, in total for a 24 hours, it accounts for every 3 hours we void. So in that particular, 24 divided by 8, that comes around to 3 hourly each void. That is the normal way. So out of the 8 times void, 6 times from the day, from the time we wake up till the night we sleep, and maximum of 2 times at night. So when you void more than 2 times at night, what happens is, the thing is your night will be disturbed and you'll have a constant urge to pass urination, and next day is gone, the whole of next day. So when we statistically speak, we say that the DALYs and QALYs, quality of lives, is definitely not well. So we say that overactive bladder takes away the quality of life and definitely destructs your next day. So, and glorified way of speaking is this overactive bladder overall will become a habituated bladder over a period of time. If we find out a reason well, and then it is the best thing we can ever do, and then we can treat it accordingly. So then this overactive bladder, we as urologists, and we are much more concentrating upon the night urination rather than the morning urination, because night urination will disturb everything for the next day. When it comes to morning urination, if your office hours are getting disturbed and you have a constant urge to pass urination, then definitely we will treat the cause. So how we find out a cause is, we have some basic bladder investigations, basic ultrasound abdomen, and we see the bladder wall thickness, and basic urine culture is definitely important. And now we, as a developing nation, rather we can call ourselves developed now, so we have this tuberculosis is still rampant, and so we even test for that in those people with communities where we have they are not affordable communities. We test for tuberculosis. But rather than that, basic simple urinary infections, those infections, like say patient will come initially with a symptom of say some mild burning urination, and I have an urge to pass urination again and again, and so he'll consult a doctor. So what the thing is, I would urge everyone to simply go for a urine culture first, and taking the urine culture, according to the culture, if we treat, that is the better symptom. Culture only reports positive if there are more than 10 to the power of 5 organisms in the culture. That is a significant culture. But significance of culture is different from significant bacteriuria. That means that urine, the bacteria in the urine coming out is different, and the culture grown is much more different. If there are more number of organisms, we get a culture positive. That doesn't mean that the patient has no infection. So we have to go in a clinical way also. If the patient, for example, if he has a culture negative and he says that, sir, still I have a lot of urge and I've got a lot of bladder pain while passing urination, I'm passing urine many more times. How can we stop that person saying that he has no urine infection? So comprehensively, we have to evaluate that patient in those senses at times. That is much more important than anything else.
Right.
So, and sometimes what happens is there are some infections like tuberculosis. There might be no sign at all, no dysuria, no pain, no burning urination, except for urine will go on showing pus cells. So there are certain variations in the diseases. So either way, urine examination and a urine culture are prime most important. And when we say that there is an overactive bladder, then we come to the causes. Simple cause, first foremost cause being infection itself, and a prolongation of infection, which becomes recurrent and then becomes resistant UTI. So this is how we progress, and this is how we think of how to treat an infection, how to take care of it.
Right. So at least now we know what an overactive bladder is, and how doctors normally diagnose and investigate to come to a conclusion that why it had happened. Now, my question is, doctor, that you have already said that frequency of going to release ourselves is one of the symptoms. Are there other symptoms also where we can say that, okay, these are the signs and symptoms of an overactive bladder? And plus, incontinence related issues, does it also come under the same term?
Yes, very good question, madam. They are entirely different, but they go hand to hand together. Like, for example, in a case of those patients with paralysis, take it for granted, they might not have infection every time. But see, when you void, if we know this, I'll tell you another basic way of thinking. See, what as a urologist we think is, there are two functions for the bladder. First one is storage and the second term is voiding. Storage is the symptom and the storage is the function of spinal cord. Whereas urinating or voiding is a symptom which comes from a central thing, and it's a higher one. So for patients, those who are having a paralysis attack, that is called a CVA attack. Okay, so they will have a malfunction from this part of the thing. So they will have storage of bladder is very well because spinal cord is taken care of normally, but the problem is from the central thing. So they will void so many times because there is no control from the central region. This is one way of telling. So as a normal person, as a layman, we can say that the patient is incontinent, not more than anything else. So they might not coin it as an overactive bladder. That is where neurologists and urologists come into play, thinking that, yeah, what is happening? Is the central control there, and is the peripheral control or the spinal control there? And there is one more thing. There is, see, in patients more than 50 or 60 years, rather more than that itself, prostate usually enlarges for a gentleman.
Right.
That is a male thing. Usually female do not have a prostate. Male has a prostate. So prostate is something which is beneath the bladder. So when prostate grows in size and it obstructs the urine pipe, so what happens is sometimes the bladder will start to overflow. I mean, rather overfunction, throwing the urine away, which is stagnant enough. After certain times, a capacity reaches of the bladder that it cannot hold anymore. So an entity called overflow incontinence occurs. So that means the capacity of the bladder is so high that whatever is produced high up from the kidney will start to overflow rather than to contract.
Right.
So these all things go hand in hand, but that is not overactive bladder, madam. So incontinence goes hand in hand with the overactive bladder, but it might not be a same thing as overactive bladder.
Right.
So incontinence can be so many types. It is from the central incontinence, peripheral incontinence, or there is a damage or a trauma. So many types of incontinence. But overactive bladder can be a symptom of those diseases also.
Right. So if we go and diagnose, maybe we'll end up knowing that actually we are suffering from other diseases like UTI or prostate enlargement in men, etc., etc. So what we are trying to say here is, please do not ignore the symptoms. Now, another thing is, doctor, that these symptoms are very common, especially people in our society in India. And people often associate these symptoms with their aging with the men, as you have already said, that prostate enlargement is a very common thing. That men will say that, see, I'm aging, my prostate, it's a normal thing. We normally have this issue. Female, on the other hand, because they have menopause, etc., so hormonal changes. Again, they'll female most of the time I've seen them with these symptoms, but not coming out and talking about it. Please tell us, or throw some light on these issues as well, because with aging or with men and women, different
Yes.
different issues, they have the same symptoms.
If we speak of females, okay, if we speak of women, especially in the if we can divide these women into premenopausal, perimenopausal, and postmenopausal women, those women in their 20s and 30s, especially sexually active women, they can have urinary infections are very, very common in them. So, and it is easy to treat them also. Just 3 days of antibiotic according to the textbooks or a urine culture will do better. So, and the biggest advantage with the female urethra is that it is only 4 centimeters in length, and the functional aspect is 3 centimeters. But when it comes to a male, the whole urethral length is 21 centimeters. And unfortunately, all of it is a functional length. So, urinary infections in male are deemed complicated always, and it is hard to treat per se. So, in a female who is premenopausal or a perimenopausal woman, urinary infection treatment is easy enough. But there are certain more aspects added to the females in the postmenopausal and sometimes premenopausal women also. Like, for example, now, if we come to the postmenopausal women, their hormonal issues are gone. The ovaries might not function as before. So what happens is the urethra might not have the same sort of a support which she was getting in the past from the perineal or perineum or the vaginal orifices or vaginal supports. So what happens is the bladder itself descends. Okay, that is called POP concept. So, or in a glorified and layman terms, they call it a cystocele, rectocele concept. The whole, the urethra, bladder, the uterus will descend down. That is called pelvic organ prolapse. So that sort of a thing, what happens is, so there will be some amount of urine which is not passed. So they will have a post-void residue. If the post-void residues are going high up, then those are the causes of urinary infections in females, in postmenopausal women. Sometimes that will be so severe. I have seen that the whole of uterus and bladder, everything has descended down, that she is not at all passing urination, and they go in renal failure and kidneys are swollen up very badly. So that is what is to be taken. And there is nowadays, these days are rampant with diabetes, hypertension. Everyone stress, and stress. Official stress, what stress, that stress is the common for everyone. So when it comes to these diabetes and other related diseases, so when urinary infection associated with the comorbidities are there, we have to treat the comorbidity as well. For example, so you love sugar, so does the bacteria. So diabetic patient is very much prone to infections again and again. So an appropriate way of treatment is very much necessary. I say that the urine culture plays a prominent role here, madam. Okay, because when a patient comes to me as a urologist, they would have passed the first tier of MBBS or a general physician, then an MD or a MS gynecology or whomever it is. Then next comes the third tier. So I stay at the highest of the hierarchy for a urine infection. So when a patient comes to me, it obviously means that it is a complicated one. Very few people come to me straight up. It is not that they do not know. Now that I just want to make a note that I need to make clear that awareness must come. When a urine infection comes, yes, they must do a urine culture and a routine examination. And if they are comorbid people, it must be pretty well, they must be knowing that, yes, they must see a urologist, whoever is nearby, so that they can get a correct way, and the approach must be correct. Okay, your approach is prime important rather than anything else. The antibiotics, wherever you go in the whole universe, are only these many. But the approaches, not everyone follows the same approach. So protocol, according to protocol, if we go, I think that no one will miss. And if you are a junior colleague, there is no harm in asking a senior colleague to say, sir, yes, I am having a trouble. Please kindly help me out. So I don't think this is a simple one, I believe.
Right. So
So
rather than suffering in silence, we must come forward and go to a doctor. That's really important if we have these symptoms.
yes, ma'am.
Okay. Doctor, now we would also like to talk about the treatment options available for treating an overactive bladder.
Simplest concept is, if you know that you have to pass 8 times a day in a minimum, that is every 3 hourly, and two minimum or twice at night. Okay, that is bare minimum, not more than 2 times at night. So we establish the treatment protocol. What I believe is that you must not pass more than twice at night at the maximum.
Okay.
And morning, if your office hours are not getting disturbed, that itself is the treatment protocol. And this is the baseline of how I treat. And the second thing is that if I'm finding an objective assessment of an infection, I will treat it according to culture. Be it tuberculosis, be it simple urine infection, be it complicated urinary infections. And then if the complicated urinary infections are spreading out to the upper tract, that is the kidneys also as well, especially happens in diabetics and those patients with chemotherapies and cancers. So we must be taking pretty care of them. And if it is a complicated UTI and the patient is especially throwing fevers and all, we better admit them or evaluate completely. And coming to drugs, there are so many drugs in treatment of an overactive bladder, especially for frequency purpose. So if there is frequency, then we reduce the frequency. There are certain drugs, so we reduce the frequency. There are anticholinergics. There are multiple anticholinergics nowadays. So there are a few of them which are very good for children, like oxytocin, and for adults there is solifenacin and mirabegron. Okay, there are so many drugs. These are real good drugs. So actually they are pretty fair enough and working well. Yes, they might have some side effects. We have to check them out. Some constipation in some patients, but it does very well in majority of the patients. And if we treat what I believe is treat the crux, everything is gone. Frequency is gone, urgency is gone, and everything is gone. For example, if an elderly female comes with a pelvic organ prolapse and she has all this trouble, okay, then she better undergoes, okay, elevation surgeries or, that cystocele repairs or some surgery so that it will be helpful. Not all things, not all surgeries might be doing very well for this, but if we get an appropriate answer and treat the crux of the matter, it will be better.
Right. And only a doctor and a urologist in this case can help us out. So please don't waste your time. Please go and consult your doctor. Don't waste your time in self-medication as well or over-the-counter medication as well. We'll pick some of our viewers' question as well. Dr. Shweta Verma is asking, diabetic population is also affected. How we can overcome? I'm assuming she herself is a diabetic patient.
Pretty cool, madam. Nowadays, see, India has become the not alone the diabetic capital, it will become diabetic capital of universe, I believe. So diabetes is very prominent, rampant. Okay, be it stress-related diabetes or be it diabetic type 1, type 2. So the simplest glorified concept is keep your diabetes in control. First thing, and see that your 3 months sugar levels are always common. HbA1c level somewhere around 6, 6.5. That is the best thing you can ever do. And more so, take plenty of water. Okay. So when it comes to overactive bladder, what we say is in the evenings, I am always concentrating on evenings rather than on the mornings and passing out more at nights. So take plenty of fluids in the mornings, less in the evenings, so that you pass less in the evenings and sleep. That is the best way. Keep your sugars in control. Get an ultrasound done every 6 monthly or so, at least an yearly. When you go to your physician or whomever diabetologist you are checking out, a physician, endocrinologist, they'll definitely ask for an ultrasound and they'll check for your upper tract or kidney levels and a simple urine examination. If there are more pus cells, definitely go for a culture.
Right.
If necessary.
Right. We have Sabri Nathan asking, can pregnancy lead to an overactive bladder?
Very well, madam. The wonderful question asked. Actually, that you need not call it an overactive bladder. When in the pregnancy, when the baby is compressing on the bladder, the holding of the bladder is less. So you pass urine many times, especially when it comes to second and third trimester of pregnancy, that is from 4 to 6 months onwards to 9th month, you pass pretty many times. That is because the bladder capacity will become low because of the head will be compressing on the bladder. And one thing is for sure, pregnancy related urinary infections must be treated 100% as very important, because they might lead to some abortions many times, and kidney infections and IUDs also, because we have seen them. So pregnancy related dysuria must be treated. That is the reason why this society, Incontinence Society or Bladder Wellness Society, they have put that in the first trimester of pregnancy, it is better that every patient or every pregnant undergoes a urine culture in the first trimester.
Right. Ankur Prakash is asking, so if someone is leaking urine during laughing or sneezing, does it belong to incontinence or OAB?
Very good question. It is an incontinence. See, now this question has to be divided into two. If it is a male and if it is a female. Usually males will not be incontinent while they are laughing or coughing or what by putting the pressure on the bladder, unless their sphincter is lost, like doing a surgery for a radical prostate surgery or something. So for a male, there are now there are artificial sphincter surgeries are all existing for that. In male, the question what Mr. Ankur has asked, that's a genuine question if it's a post-operative one or a trauma one. Right. But this question often applies to a female. That is because of a postmenopausal or a patient with a hysterectomized female, those whose uterus is removed surgically because of certain diseases, whatever be the disease. The pressure inside the abdomen, or for example, if the patient is a continuous patient who has cough, she goes on coughing and the abdomen exerts pressure, that bladder and the rectum goes out. That is what is pelvic organ prolapse concept. So when there is a pelvic organ prolapse, with uterus, without uterus, and when there is an amount of post-void residual remaining, you better get treated with a urogynecologist. That is a must thing. This concept females, many female, actually 80% of the post-hysterectomized females or old females, they do not come out saying that when I pass, when I cough, I get urination, or the severity of this disease goes to such an extent that the patient sleeps and sits, she will pass almost all amount of urination or some amount, which is making the innerwear wet. But these are taboo issues for a female. Okay, these are social issues. They do not come out unless they feel that it is that is taking very much of their lives. So I would advise this particular thing to be taken as an incontinence. This better be treated.
Right. Especially after postpartum, because, after vaginal deliveries, again, women, their pelvic floor, etc., kinds of weakens. And is it again a reason why, incontinence related issues are very common?
No. See, when you have multiple normal pregnancies, multiple normal deliveries, the pelvic floor weakens. So such patients usually have a pelvic organ prolapse over a time in the future. But more than that, there are certain more issues for a thyroid female, for a female with a thyroid and obesity, okay, and overweight. These are the things which are prime more important. For example, multiple pregnancies do matter, but over a period of time, for example, say, take it for question. If you have multiple pregnancies, if any patient has a multiple pregnancy, still she might not leak every time, but over a period of time, when she puts on weight, she has certain diseases, she grows old. So all these things come into scenario, not one or two. Yes, I understand that multiple pregnancies will weaken the bladder, the pelvic fascia, but there are certain things called Kegel exercises. Okay, and now in these stressful related lives, we do not do exercise until a doctor says us, please do some exercise.
Right.
These are the bad days when someone has to say, go and eat at time, go and do exercise at time. Unfortunately, this applies even to doctors also.
I completely understand what you're saying. And about the Kegel exercises, only Ankit Chaurasia is asking, are there exercises that can strengthen pelvic floor muscles to help with incontinence? I think Kegel exercises.
Yes, they do help, but they have to be done at a period of time, 3 months to 6 months to 9 months.
Okay.
They are called pelvic floor muscle exercises. They are really good, even for men.
Right.
Especially women and men, both. I would advise every incontinent female to have this.
Right. Doctor, what should a patient do if he or she thinks of having OAB, or if he or she thinks that, okay, I have these symptoms. Maybe they were not aware that it comes under OAB. Now, as they know, what should they do to reduce these symptoms? Anything that they can do by their own?
Yeah, please come to me.
Definitely, that is one thing that
No,
you
I,
have to
I
think.
I mean to say is, for example, if a patient is unable to meet a doctor, and if she is having severity of OAB, simple things: cut down fluids at night, so that night you might not be passing.
Right.
Okay, and try to meet your doctor. But rather than that, if she is having some burning urination or anything like that, or if the patient is a diabetic or with some comorbidity, they better have a urine examination done. If the pus cells are more, then let them give a culture. Simplified answers, these are all. And see, that means to say that, see, after 40 years, madam, I believe everyone must have a regular checkup. Maybe that is the reason why all the companies are asking everyone to please have your checkup, so that we want your quality of life and dailies to be nice, so that organization and work will nothing will be affected, even including health.
Exactly. So an annual checkup, health checkup is what you're suggesting. It's
Yes.
important. Plus, if you have these the symptoms, other than having some lifestyle modifications, one more thing that you need to do is to go and talk to a doctor, a neurologist in this case.
Yes.
We have few more viewers with us. Adi Jan, first of all, is wishing you a very happy Doctor's Day. And
thank you, so nice of you.
and then his question is, what are the side effects of long-term medication of OAB?
Simple question, sir. When you use the term long term, okay, first thing is that means the crux of the matter is not treated or untreatable. Both the things will come into play. The medication long term, see, any anticholinergics, you will have constipation is one big thing, man.
Okay.
Constipation is the biggest trouble. And the other thing is that, yes, your bladder capacity may increase and you may go into retention with these drugs also. So other than that, I do not find anything. If you do not treat the crux of the matter, everything will go wrong.
Right.
Every time it is the crux or the disease or the entity, anatomical entity, infected entity, that has to be treated. For example, if you have so much of overactive bladder, I have seen patients, even their sexual life is affected. Yes, females, they don't even want to have sexual activity when that sort of a thing is there. And males might lose confidence and might even have an erectile dysfunction because of psychological effects. I have seen this. And sometimes there is an entity called vesicovaginal fistulas. Post hysterectomy, some patients might land up in bladder in contact with the vagina, the part. So urine will be constantly leaking. So that will be foul smelling for the patient and for everyone. So their sexual effects are like, it's a hell to even to think of. So even in those aspects also, if we ask, overactive bladder has to be treated, you go to the crux of the matter and treat. And for example, sir, if you have a long acting, if for example, this is a scenario which I must not talk, but I'll tell you, if in true, what happening in the reality. See, you go to a physician or you go to anyone. Physician means at least who has done his MBBS also, or anyone whom you have approached. If you are being treated without a culture, okay, any idiotic antibiotic will work on you for a while. What after that? The organism inside might not die, so it will come as a resistant one. You'll go to another one, the same story occurs, maybe for a longer duration. And third time, so this is how recurrent UTIs occur. And those UTIs might not leave you. It will take a long time for you to get treated. So these sort of things will go and sit on your psychology. You will go on changing doctors and nothing is going to happen. So habituated OAB comes here in this place. And sometimes I have seen, these are all common things. When a disease affects you for a longer duration of time, your psychology adds to it. You cannot treat psychology. You can treat the disease, but that is why empathy is as important as you treat the disease.
Right. So it's important because I can understand, that how much stress can be associated with the symptoms, how much social stigma it is,
Yes, yes.
especially I've seen so many people who are so scared to go out and in public places or in functions because they are always worried that whether if I don't get any washroom to release myself, or what if, I end up leaking. So there's a lot of social stigma as well associated
Yeah.
with it, as you very well said.
See,
And doctor, one more thing that I would like to ask is that if we keep on neglecting these symptoms, as you said that many a times these symptoms will actually tell you that actually you are having some other problems like a prostate enlargement or UTI, etc. Now, if a person is continuously ignoring these symptoms and not talking to a doctor, not taking an advice from a doctor, what can happen to that patient? How dangerous this can become?
see, very well, madam. See, there are so many, all five fingers, they are of different types. So are people. Okay. We cannot control them. It is their brain which controls them. See,
Right.
at the end of the day, when you go on ignoring these urinary infections, they'll spread out to an extent that their kidneys might get damaged. They'll have chronic pyelonephritis. This is the thing with diabetics, actually. Once the kidneys are gone, see, the once a kidney is destroyed, that is called nephropathy. If a kidney is destroyed because of an obstruction, that is obstructive nephropathy. So initially, because of a stone, if there is a continuous stone, or if there is a urine infection going on, or a prostate enlarging, and the patient is ignoring, someday urine, rather than going outside, it will go up and destroy the kidneys. Once the kidneys is destroyed, God bless America. Sorry, God bless India now. This is what is going to happen. Once the kidneys are gone, it is very hard to bring them back. Yes, we have so many drugs, we have all dialysis, we have all sorts of instrumentation, everything. But if our the baseline concept is wrong, then things will be wrong. I understand. Yes, some people can be stubborn enough not to go to a doctor. Okay, I am with everyone, actually, sir. Okay, I know that you might have met with someone who has given you some drugs which might have already gone wrong. Not all doctors are bad, not all doctors are good. Okay, it's like same five fingers which are not equal. But simple concept, sir. If you have a trouble, kindly approach someone at least whom you like.
Right.
But still, do not. At least whatever. See, now that in these ages of internet, if you just type the name of a urologist, nephrologist, cardiologist, you'll get a good names at least. Try to meet them. If they get into the crux of the matter, what more should you want, sir?
Exactly.
Nothing more than, see, this particular proverb my father always has been saying, or everyone knows this very well. See, if wealth is gone, something is gone. If wealth is gone, everything is gone.
Right. Very well
So
said. Yeah, and
prevention is
that's right.
always better
And
than cure.
completely agree with you, and that's the whole purpose of having this session, that we can at least make the people aware that, see, these are common symptoms. It's quite common with people. Come out of your control, comfort zone, and go and meet a doctor. It's important. You'll get treated, you'll get complete relief. Don't hamper your quality of life. It's of no use, and of course don't risk your health. That's important. Deepak Upadhyay, does OAB lead to UTI?
UTI might lead to AV.
Mm-hmm.
See, if you make it a habituated thing, vice versa, why not?
Mm-hmm. Exactly. So it's the bottom line is, please don't ignore your symptoms. Doctor, what would you like to tell to our viewers? As a takeaway note, what are the things you would like to say to our viewers?
Yeah, sir, glorified thing, take plenty of water. If you think you are having an overactive bladder, or increased frequency, decrease your water content at night, fluid content in the evenings, so that you might not pass more than twice at night and destroy your sleeps. And the third thing is post-menopausal females. Okay, I understand that it still is a taboo, but kindly approach your urogynecologist or urologist, whomever it is, and especially those with comorbidities, like diabetes, patient on chemotherapies, patient with cancers and all stuff. Kindly meet your doctors, that they'll help you out. And last but not the least, plenty of fruits will do very good. plenty of water will do very good.
Right. So an overall healthy lifestyle is going to really help you. But okay,
Simple lifestyle.
yes.
Simple lifestyle is the one which is more important. And nowadays, in this era of stress, we are losing our lifestyles. So just follow the simplest and glorified lifestyles, and the lifestyle in a simplified way. You see, timely food, timely water, avoid junks, avoid smoke and alcohol, but to your best. I am not asking you to stop it completely, but to your best,
Right.
and to your conscience rather. That will do everything. And kindly meet your doctor in necessity.
Exactly. So please don't suffer in silence. Please go and talk about it. Meet your doctor. That's really important. Thank you so very much, Dr. Krishna Karthik, for your valuable time, sir. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. Thank you so very much once again.
Thank you, ma'am. So nice of you. It has been nice talking to you and even to the viewers also. And thank you, sir. Jai Hind.
Pleasure, sir. Pleasure. And thank you, our viewers, for an excellent participation. For more information and updates on the overactive bladder, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you.